I now invite Mrs. Nirmala Desikan, the Chairperson of Consumer Association of India, to felicitate Professor Dr. Sudha Seshan with the shawl and memento. Thank you, ma'am.
More than 80 research articles to the Science Encyclopedia.
Respected Director of the Tamil Nadu Medical Services Corporation, most respected Shri Santanamji, the Honorary Director, Chair on Consumer Law and Jurisprudence, the Tamil Nadu Dr. Ambedkar Law University, Dr. G.S.K. Velu, Chairman of the Neuberg Diagnostics, the Consumer Association of India, members of the activists, members of the health science. At the outset, my very sincere gratitude to Shri Santanamji for making me a part of this morning's deliberations. It should be the outcome of a balance. And I suppose it is this balance that would be discussed upon today. A balance between the demand of the consumer and the supply of the expert. A balance between the health condition of whom we call the patient and the relief given by the doctor. A balance between the advancement of complementary and auxiliary services and the judicial provision of such ambience at reasonable cost, and the balance between the real-time demand of health and healthcare and their supply in adequate and appropriate measures. However, all of us are aware that this balance often gets tilted more to one side or fluctuates and consistently pushed behind work, family, society, and even entertainment. I've seen many people tell me that they are seeking relief for a pain that had been there in the same sky. Reason number 3, the misplaced awareness due to advices, opinions, reading, and analysis. Gone are the days Shri Santanamji reminded us of the concept of a family doctor. But then, on the flip side, gone are the days when a distant aunt would walk to you but you still have the aunt being replaced by internet uncles and web-veiled grandparents. And pardon me, I'm not supposed to be quoting a particular brand name, but then we have a new breed of medical men and women, if I may call them, in the veil behind the Google doctors. Association, of course, with the Neuberg Ehrlich laboratory. All the 3 organizations have together, in their collective intelligence, thought of a panel discussion on all these factors. Factors which concern the healthcare sector in this country. And I'm happy to inaugurate this seminar. And as part of inauguration, I would like once again to draw your attention to a very small thing which most of us have overlooked. Even members of the medical fraternity have overlooked. The symbol to indicate a doctor, most of us have seen this symbol. This symbol, care sector. I'm happy that this panel and this session today would be addressing all those issues of mal-awareness, mal-knowledge, misunderstanding, misunderstood wisdom. With these words, I once again take happiness in inaugurating this seminar and session, and I wish not only the seminar all success, but also wish that there is a lot of take-home message that emerges out of this session? Thank you very much.
Representatives from all the consumer associations. I wish you a warm morning, and first of all I would like to thank sir for inviting me for this good event. It's a bit difficult to summarize all the initiatives which the Tamil Nadu government and government of India have taken to make the consumers, basically the poor people who visit government hospitals, better off in terms of satisfying their health needs. Nevertheless,
good morning. Respected Professor Sudha Seshayan, Honorable Vice Chancellor, Tamil Nadu MGR Medical University, Director, Tamil Nadu Medical Services Corporation, Dr. Ambedkar Law University, Mr. Ramachandran, and my long-term acquaintance and well-wishers, Mrs. Desikan, and her fantastic talk by Vice Chancellor and the TNMSC MD. I think some of my ideas have been already very well articulated. And one thing which I can say, availing from Tamil Nadu, we should be proud and happy that we are actually in a state where healthcare is given a lot of importance, in which government, the private institutions and the non-governmental organizations all exist in harmony. Compared to many other parts of India where we see so many scams, so many controversies and so many conflicts, we probably have less of it. I wouldn't say nil, but definitely less of it. Consumer engagement is good and consumer awareness is good. Consumer overactivism and too much legal issues which that actually scares us as medical professionals today. And this is where we want to actually engage with consumer associations closely to ensure that the consumers get right kind of knowledge. Today, the big what is affordable? What is affordable to me or what is affordable to somebody else or for a third person may be quite different. So what is the difference between healthcare in this country and elsewhere? Because you go in other country, the cost of healthcare is never discussed because it's usually taken care by the healthcare insurance companies or by the government. Like a UK model where the government has NHS, or go to US model where the insurance takes care of it. So the consumer need not have to decide what should be the investigation, whether that investigation is adequate, whether right technology is deployed, what kind of procedure should be done. These are all taken by learned people from the insurance industry or from the government. Today the consumer, when he is asked to pay out of pocket, then that's where all the problem starts, the affordability really starts. So I think with all this Ayushman Bharat or the CM scheme, all this going on in our country, hopefully we are not far away from a day in which every Indian is covered by some kind of health insurance or other, and that will be the first part of delivering affordable healthcare in this country. And it's good that government is now, it's an election issue for a change. Healthcare is being, Dr. Manath was saying, even private health sector is prospering. Whether you talk about best cardiac hospital, best affordable hospital, best ophthalmology hospital, all of them are located in Chennai. So when all of us work in the central part of medicine today is transparency.